It appears that November of 2025 has been a very eventful month. In any rate, on November 19, the CDC changed its website under directive by President Trump and Robert F. Kennedy Jr. The under uh, Secretary Order. I will read those changes verbatim, and then we're going to discuss in order not to create any confusion or any discrepancy in the statements. Previously, on the web page of the CDC, the content was the CDC vaccine safety page, www.cdc.gov/vaccine safety about autism hotmail, unequivocally stated vaccine do not cause autism. This was supported by decades of rigorous research, including large scale studies from the Institution of Medicine, IOM, recently changed the name to National Academy of Medicine, and the Agency for Healthcare Research and Quality, AHRQ, and global health bodies like World Health Organization, WHO, and it cited evidence showing no causal relationship, emphasizing that autism is a neurodevelopmental condition with genetic and environmental factors emerging before most vaccination. The new content after November 19. The headline remains vaccine do not cause autism, but now include an asterisk linking it to a footnote. The header vaccine do not cause autism has not been removed due to an agreement with the chair of the U.S. Senate Health, Education, Labor, and Pension Committee that it would remain on the CDC website. This referred to Senator Bill Cassidy, a Republican of Louisiana, who secured this pledge during Kennedy's February 2025 confirmation. A new bolded statement declares vaccine do not cause autism is not an evidence based claim because studies have not ruled out the possibility of infant vaccine cause autism. Additionally, text claim that health authorities have ignored a study's suggestion a link without citing a specific study or evidence. It refers to a brief timeline and summary of key findings related to 1986 directive from Congress regarding the pertussis vaccine and autism, implying historical cover. Well, all of this was verbatim. I just read them for you to notice it, and then there shouldn't be any uh, discrepancies or any type of confusion or ambiguity to it. However, when it comes to the research and when it comes to reading a research or anybody present a research, there are a specific requirement for a research or a project to be noticeable, to be applicable, and to be dispersed as a factual findings. The study should be double blind, meaning that all the people involved in it should be blind to the finding, not to have a bias. It should be placebo controlled. It should have a control system, a group, active and control, and it should be peer reviewed and should be reproducible. and should be involved in later on uh, uh, postdoc evaluation and reevaluation, and also should be involved in or uh, including later meta-analysis, because many studies could be published in many countries, all of them reasonably well done, but should have a small sample. A study with a uh, patient on it, or a study with 5,000, or a study with 50,000, or a study with 200 or 600, they are different outcome. The number should be very critically evaluated, see if there is any missing data. Has it been peer reviewed? Has it been placebo uh, double blind controlled? And also, to be honest with you, who did it and what methodology they used, and who was the study coordinator, who was the. It doesn't matter whether this was X from this small town or this huge guy or guru from this big university. That's not what I meant. I meant that what they used, what was their null hypothesis, what was the procedures, how they did it, and how they published it. These are all that you should consider when you see anything, whether it's a Time, whether it's the Washington Post, whether it's the American Medical Association, or Circulation, or any type of medical journals. As such, for the past 35 years that I have been practicing, I have not seen any vaccine causing autism. And I have not heard in my area, and I have practiced in many states. There are some speculation, there are some suggestion, but remember, the vaccination, different type of vaccination, goes back to 200 years ago, from the time of Pasteur, from the plague, from the other component of this. Even goes back to the thousands of years in China, that they did some type of inoculation. So the vaccine seems to be safe, and there is no causal relationship, cause and effect relationship between vaccine and autism in infants. Speculation, yes, but there is no solid evidence. Although vaccination is a right, is a privilege that people can choose or cannot choose. That's another story. Nothing should be forced. However, is important. For example, when the measles came, measles has been around for hundreds of years, even in remote countries. Measles is available. Smallpox available. So if a person gets measles and you don't treat them, or even if you treat them, it might get the whole community and it kills. Pneumonia in older kills. Many diseases kills infants. So it is wrong to change the narrative and change a statement. It is wrong to remove the safety of the vaccine from the website, and CDC should revise and redesign the website. The physician, I have talked to many before I give this video. I called number of the people in different, number of the physician in different domain. I talked to 2 or 3 infectious disease. I talked to 2 or 3 different pediatricians. Everybody's against this statement. I'm not a pediatrician. I'm not an infectious guy, but I'm a physician involved in healthcare and preventive care, and I'm very much for preventive care. The health of this country is based on the health of the younger generation and those that were born 10 years ago and they're going to be born 10 years from now. The students, meningitis, we have to think about this. HPV, we have to think about these health issues. Vaccine is safe. All the evidence is there. There is not much of the evidence against it. There are some scattered information here and there. But a study, remember, must be placebo, double blind, must be reproducible in a large scale, and should be done with a good group of the people who have experience in doing research. Doesn't matter coming from this rural area or coming from Hopkins or Oxford. Doesn't matter. Research, a solid research is a solid research. Even observational research is a solid research. So remember that. We are not talking about being from Ivy League. We are not talking about to be from this institution. We are talking about being this group of solid individual in the rural area that talk about measles. Those are solid, based on their procedures that they apply to the research. Remember that.